I am honored, truly, to have our next guest, yes, who is following the footsteps of some of your predecessors at this. This is Wei-Wu,
Yes.
and he is the CEO of HLI, or Human Longevity, which is one of our partners and one of, I think, the most exciting companies around. So thank you so much for coming in.
Thank you, Howard.
As I mentioned, we had Craig Venter on, who was one of the founders. We had David Caro on, last year, and now it's your turn. So it's an honor to have you
That's
here.
great. Thank you. Thank you.
So while I was actually, let's just start off first. For those who don't know what HLI is, can you just give a quick little, just explain what HLI is and the power behind it?
Yeah. Well, HLI is really to put it shortly, is the Central Intelligence Agency for your individual's health information. So, because in order to do preventative medicine, you need to have a lot of data on you. Because now with the genome sequencing is completed, with all the technology is available, we can collect 150 gigabytes of data from your body within 3 hours. And so how do we analyze that data to provide you with solution to do preventative medicine or disease prevention? That's really the essence of what this company is all about.
It's a lot of data. How do you? So, and part of that is understanding what's noise and what's actual real data.
Right. Yeah.
So, as I was preparing for this, I was looking back at your history, your career, which is amazing. So I want to start even before we get into your path in training.
Yeah.
What got you even interested in medicine and health?
Yeah. Well, that's a good question. Actually, I'm going to be a little bit provocative, here. So we have probably over 100 people here. And we all know one thing, so far nobody can change. We're all going to die, okay? Do we have an agreement on this topic? Does anybody of you here knows exactly what you are going to die of? Whoever knows about it, raise your hand. What disease, what specific disease you are going to be die of? Nobody? Do you think your doctors know that what disease you will be die of? Okay, so actually, I'm glad I haven't seen anybody raise their hand. They already know what disease they're going to be dying of. So let's keep that as a question in our head. So my actually personal involvement in life sciences really started when I was about 7 years old. I was growing up in China, and my parents was sent to the countryside to be re-educated. So I actually grew up with my grandmother. My grandmother came home one day and was diagnosed with late-stage cervical cancer, and she died within a month of diagnosis. And I wish at the time, obviously retrospectively, I wish I knew her condition 5 years ahead of time. Because clearly we all know cervical cancer is caused by HPV viral infection, and it takes years for that virus to transform your cervical epithelium cell and eventually create a tumor and eventually metastasize and kill you. It takes years. And there's all kinds of preventative medicine, including today we have a vaccine for that. So my interest in life sciences really started when I was very young. So my whole life is on, in research in biology. And so I came to this country, wonderful country, with $50 in '86 to do my PhD, and thanks to President Jimmy Carter. And I got a fellowship, and I have to be the top 50 student in China to qualify for this fellowship. So I went to Baylor College of Medicine and studied molecular biology. Actually, the first gene I ever cloned is a gene called PSA. And I then went to Mayo Clinic because my whole life's interest is in research and how to turn research into solutions. So I went to Mayo Clinic. We actually did the early clinical validation of PSA as a test for prostate cancer. Then eventually I went to Mass General for a few years. And I'm a PhD scientist, but I went to the surgical department. Okay, so, and my mentor, Pat Donahoe, is a very well-known surgeon. And my trade with her is that she will teach me how to do surgery. I will teach her how to do molecular biology. By the way, after 20-some years, I'm still working with her. So I was the very few PhD scientists spends a day a week in the operating room as watching. I cannot cut. Okay, but in 1993, purely by accident, I bumped into Dr. Craig Venter. So my relationship with Dr. Venter started in 1993. So he convinced me to leave Harvard and joined with him the first large-scale genomic company called Human Genome Sciences. And HGS was started in 93. We were the first company doing large-scale DNA sequencing, buying hundreds of sequencing machines and do large-scale sequencing. And we all know that Craig eventually started another company called Celera and was the first company to decode the first human genome. When I left Harvard already offered me an assistant professor job, and that was like my whole lifelong dream is to become a Harvard professor. But Craig says, don't worry, we're going to change the whole world. We're going to decode the genome and all that. So I actually went with Craig to Maryland and started with Human Genome Sciences. 4 years later, I actually, by then HGS already went public. We're already trading about over $1 billion market cap. One day I suddenly had the enlightenment that actually startup company is one of the best vehicles to commercialize innovative life sciences ideas. Because in the university, you can write a Nature paper, a science paper, you can write in a New England Journal of Medicine paper, but usually that's the end of it. In a startup company, you can form a group of people and raise enough money, and you can commit to a particular product or service and really go for it. So ever since that realization, I have been building companies. So I built my own company, Origin. I have started my own VC fund, ETP, which has funded about 70-some biotech companies. So one of the reasons we got involved in HLI, coming back 360 degrees, is I went to see Craig in 2015. Mm-hmm. And Craig said, I'm starting a new company called Human Longevity. And I think that's the round you guys invested.
Yes, it is.
So we put in $40 million into it in the Series B. That's how I got on the board of Human Longevity, because longevity is always something deep in my heart. And so we got committed to Human Longevity. And then I got on the board. And then a year later, I think the company really, all life sciences company burn money like crazy. Yeah. A year later, nobody wants to invest in HLI anymore. So we are the only one willing to put additional money into it. So now I have a job. But I'm the only CEO pays zero salary. So anybody come to negotiate with me about their salary, say, I will set the example for you. Okay, so that's how I got involved in HLI.
How's that for honesty, right? I mean, how often do you hear that? True honesty.
Yeah.
That's wonderful. Yeah. So now that you joined, so now you're running HLI. Uh-huh. Can you tell, so part of the thing that I'm fascinated about, first off, let me just say, I think that the story of your grandmother really, especially in today's day and age, shows us that there is so much that we can do both in technology, but like we were talking with Dean, is preventative medicine, just small changes. But as you mentioned, there's an HPV vaccine that literally, if we make sure it gets out to people, can really change the face of cervical cancer and head and neck cancers around the world. And we really are a global community. I'm sorry, this is one of my passions, is making sure that it's not just in the United States or in China or in countries that can afford it, but we really owe it to everyone that we get these vaccines
Absolutely.
out
Yes.
all over.
Yeah.
So sorry, that was just a side note that I know that it's probably a passion of yours too.
Oh, absolutely, yeah.
With HLI, one of your products, Health Nucleus.
Yes.
Can you just share with everybody first off, what Health Nucleus is?
Yeah.
And I just wanted to see if you could compare and contrast it a little bit to what our current healthcare system is like.
Yes. Well, I'm a big believer in preventative medicine. And this is why I keep asking people, do you know the disease you will be, dying of? For my grandmother, maybe a year before her death, if we knew about her condition, it's probably a curable disease. So the Health Nucleus really is, in the layman's term, you can think about it as the Mayo Clinic Executive House. Except the Mayo Clinic Executive House still don't do whole genome sequencing, still doesn't do whole body MRI. We are using the absolutely bleeding edge technology to collect 150 gigabytes of data on you and do AI machine learning analytic to do disease prediction. For instance, we have a dementia model, probably is going to get a 510K approval. So we can predict what's your dementia risk. And I'll give you a few anecdotal examples. There's actually a PNS paper coming out on the first 1,200 patients. So we already done 5,000 patients. These are not patients. These are people came to our clinic. They're healthy. They think they're healthy. But the reality is the PNS paper will show you in a week or two, 2% of them already have cancer in their body. They don't know about it. 2% people has brain aneurysm. And 40% of people have high liver fat and metabolic metabolic diseases. I'll give you one example. And sometimes, when a physician tells you, your blood sugar is slightly high, doesn't mean anything. We usually don't take action because you don't feel anything. Your liver fat is at the 5%. What does that mean? So for me, I already, after I become the chairman of this company, I said I better look at my data and carefully. It turned out to be when I look at my brain MRI, there's already these white matters in my brain, which is caused by the collapse of the micro blood vessel due to slightly elevated, blood sugar level. But my liver fat is 5.7. My visceral fat is 5 some liters. So it's actually the brain image really convinced me that I have to take action. So in the last 6 months, I lost 10 kilograms. Well, I have a lot of resources. I caught up.
For the Americans,
yes.
How many pounds is that?
It's about 23 pounds, right? So I lost, But I have a lot of resources. I actually did it a very easy way. I caught up my professor, somebody I know really well at the Harvard School of Public Health. He's one of the best metabolic scientists, and Toby. And he said, Wei-Wu, I give you a solution. You cut down a little bit of your carb and then do 1 day intermittent fasting every week. So I followed his procedure. I lost, 20-some pounds in no time. And then I went back to our MRI machine. My liver fat already dropped down to 2.5%. I lost 1.5 liters of visceral fat.
Wow.
Okay, and my hemoglobin 1AC went from 6.5 down to 5.3. So you can take action on your health. But the most difficult part of health data is sometimes it's difficult to convince people. The art of persuasion. I always use an example. The people who work with me at Human Longevity, they always hear about this. I don't know if you guys ever heard about Dr. Samuel Weiss. The guy first proved to people that gynecologists should wash their hand to decrease women's death rate at birth by 20%. But that paper, using a lot of data, took 50 years to convince medical community to wash their hand. How many women has died because their physician didn't wash their hand? it took 50 years. The guy actually died in the insane asylum, okay, before his medical practice was accepted by the medical community. But if today I tell you that, hey, everyone should cut your liver fat by, 30%, some people will listen, some people won't. Okay, so how do we create enough data, right? So the power of data is really, I think, the essence of HLI. Because I personally think, anybody had a baby before, when the baby is born, we usually do a blood collection on your neo, and historically you only test 2 genetic disease. But with the genomic technology, you can do, using the same cost, pretty soon, to have all 20,000 genetic disease tested in the future. And I truly believe, although our current service for HLI is pretty expensive, I'm a big believer in 10 years to collect 100 gigabytes of data on anybody in the whole world, 7 billion people, is going to be less than $1,000. And you only need to do your genome once in your life. You don't need to do it over and over again. With that information, you can really come up with a low-cost solution to do predictive medicine. And some people have cervical cancer risk. Some, like Angelina Jolie, she's born with a BRCA1 mutation, so she has a high risk factor for breast cancer. So you need to know about it. Some people are carrying, cholesterol genes. So I'll give you one example. We have a 50-some-year-old people coming into our clinic, and his father died of a heart attack. His grandfather died of a stroke. And his cholesterol level is sky high. The physician keeps telling him to take Lipitor and exercise. But after he's done that, his cholesterol level is still high. So after the genomic analysis, we immediately find out this patient has a PCSK9 gene mutation, which is actually inherited in his family. So his body has a totally different metabolic mutation, which creates a high cholesterol level. And we all know that there is a monoclonal antibody drug. You take one shot, your cholesterol level will go down on PCSK9 gene. There's actually also a, kind of a holistic medicine. If you take the Indian turmeric, a turmeric target is actually PCSK9. So if you want to be a little bit, less invasive, instead of taking a monoclonal antibody, you can take high dose of turmeric. Yeah. But now there's actually even an siRNA molecule just approved by FDA. It's one shot a year, your cholesterol level will go down. So because we know these genetic information about this particular patient, he can avoid his father's fate of dying of a heart attack in his 50. He can avoid his grandfather's fate of dying by a stroke in his 50, because he probably will live a very normal life with because of this monoclonal antibody or this siRNA therapy that because we know about his genetic information. Better yet, he can know his son and daughter whether we need to do even earlier prevention for cardiovascular disease, because this patient already have a calcium score of 110, which basically he already did a little bit damage to his cardiovascular vessel. So this is really, when we put all that gigabytes of data together, we can do wonders in the future.
Yeah. So, this really, it's cutting edge precision medicine is exactly really what it is, yeah. Right? And the power, I think, is really, as you said, it's not just collecting 1 or 2 or 1,500 people. It's collecting a global amount of data that you can really do true predictive medicine at a personalized level. So the power of HLI is just going to increase and increase.
Absolutely.
The longer and the more patients you get.
Yes, absolutely. For example, you will see we're actually about to make an announcement on acquisition of a company called DrForMe.ai. And Dr.For.Me actually just announced last week a formal collaboration with Mass General Hospital. So actually, as a patient, if we have all the data on you, finding the right physician is actually critically important. I give you one example. People think lung cancer is one disease, but lung cancer is probably 100 different diseases, or maybe 1,000 different diseases. If you're a small cell lung cancer patient has an ALK mutation, there's a drug like Xalkori you can take. Or if you're a small cell lung cancer patient has a NRTK mutation, FDA just approved the drug last year just specifically for NRTK mutation. So if you are a lung cancer patient, you went to a physician, for his whole life has only been using chemotherapy, you may die after 2 months of chemotherapy because doctor has their own momentum. They don't always learn the latest thing because they may not know the NRTK mutation approval in 2019 by FDA. So, but if you know your mutation, if you have an NRTK mutation, then I would actually send you to a doctor at Mass General, actually did the phase 3 clinical trial on NRTK. Your likelihood of surviving 5 years is going to increase dramatically versus if you just randomly went to a chemotherapy doctor. So this is actually the platform we are establishing, is how to use data to make you live longer and healthier. Ideally, in Chinese medicine, there's always a saying, the best doctor is their patient never gets sick, okay? But those doctors never get famous because people only get famous if they treated the terminal patient and they got 2% of the patient alive again. So if you're a doctor, your patient never gets sick, you're actually not going to be famous, but you will save a lot of lives. That's what HLI is really for. Thank you very much.
That is great.
Yeah.
Well, I want to thank you because truly, as I mentioned with Dean, we at Startup Health, first off, we're so excited to be partnered with you guys in this vision of changing longevity, making sure, again, that people live long, healthy lives. And I think the key is exactly personalized medicine and prevention.
That's right.
If we prevent it, then I think we're all going to be happier.
Yes.
So thank you so much.
Yeah.
Big round of applause.
Yeah.
Thank you.